Hi, my name is Matthias Knudsen, and I'm replying to the second prompt of Group B. For countless years, a medical pain scale has been used to quantify pain. The type of pain scale has changed numerous times, but the essence of it stays the same. In medical work, it is very useful to be able to quantify pain because you're able to get an understanding of what the patient is undergoing at the time, and it can help to make a diagnosis and address the issue. Although a pain scale is very important, it is very difficult to create one successfully. The the normal pain scale is a generic scale from 1 to 10. This scale provides a large amount of problems, some of which include the lack of mental health representation, the scale having too small of a range, no clear understanding of what each number clarifies, and many other issues that have been unaddressed for decades. The medical pain scale causes a lot of stress for the patients as it can put them in a state of confusion. For example, let's say a patient is talking to their doctor about an issue that they've been having. They are experiencing periodical throbbing pain to their left knee, and it has been affecting their mental health for a while. The doctor asks them to rate their pain on a scale of 1 to 10, and they're immediately confused. They don't know what each number means, and they don't know whether they're supposed to factor in their mental health, or whether this is strictly just pain. Her pain is periodical, and she isn't currently in pain, so she's confused whether the doctor is asking for her pain at the moment or her pain when her knee is acting up. She has a multitude of other questions, but she is too scared to ask any of them, so she just says 5. This example may sound oddly specific, but unfortunately, this is a common occurrence. It's very difficult to create an accurate pain scale that can be used to quantify the pains of others, but it's useful and important to have. In Spoon Theory by Christine Miservandino, it states, I was a little surprised as being my roommate in college and friend for years. I thought she already knew the medical definition of lupus. Then she looked at me with the face every sick person knows well, the face of pure curiosity about something no one healthy can truly understand. This excerpt from Spoon Theory shows how often people are curious about what it's like to be in pain. This quote mentions that her friend knows the medical definition of lupus, but she still doesn't know how she feels. Everybody handles pain differently, and without an accurate pain scale or tool to quantify her pain, her friend and many other people in her life, including family members and healthcare professionals, wouldn't be able to understand her pain. They wouldn't be able to sympathize with her and try and help her. There's been countless ideas on alternative pain scales that can be used, but one of my favorites has been Sonia Huber's alternative pain scale. It states, when chronic pain people go to see doctors and specialists, we are often asked to rate our pain on a 1 to 10 scale. Somehow I always get confused by this instrument, partly because I don't know what each level means. For that reason, I'd like to propose this alternate 1 through 20 scale. Sonia has been one of the many people who has chronic pain and has been confused by the pain scale. Due to this confusion, they have decided to create an alternative pain scale, a scale that uses 1 through 20 instead of 1 through 10. I believe this idea of 1 through 20 is ingenious. It allows for answers to be more detailed and precise than the normal 1 through 10. Earlier this year, we created medical pain scales to help to address the current problems that are presented in the scales. I created a pain scale that incorporated the mental health aspects of pain. I believe that my pain scale would be really helpful in solving the issue of confusing pain scales. I've decided to revamp and fix my pain scale while keeping a similar format. On my new pain scale, instead of just being from 1 through 10, like a normal pain scale, it is now 1 through 20, and from A to J. The numbers on the scale represent the physical side of pain. To lower confusion, I've I've decided to increase the range of the numbers from 1 through 10 to 1 through 20, similar to Sonia's. This would allow for more detailed and precise answers on the physical pain that they are feeling. The letters on the pain scale represent the mental aspects of pain. The lower the letter, the better you're feeling. For example, A is fine and J is mentally distressed. The farther down, the worse you are. Using the same example from earlier about a patient who was talking with their doctor about an issue they've been having, and they're experiencing periodical throbbing pains to their left knee, which has been affecting their mental health for a while. Instead of just being confused on what each number means, and if they should factor their mental health into each question, they are now able to give a more precise and clear answer without having as much confusion. The patient would be able to say that they're feeling 12F. This means that they're in a lot of pain and their mental health has been poor. I believe that if we institute this medical pain scale or a pain scale that is similar to the one I have created, we can eliminate a large portion of the confusions and challenges that has been brought up by these scales. These pain scales are incredibly useful, and if we are able to eliminate the flaws of them, we can help to understand each other's pain.